All right, now we're joined by Dr. Howie Mell. He is a board-certified emergency physician. He got his degrees in public health and medicine from the University of Illinois, Chicago. He's also a board-certified EMS, a member of the editorial board for International Trauma and Life Support. He lectures frequently throughout the country. He did his residency in emergency medicine at the Mayo Clinic in Rochester, Minnesota, and he currently practices at a trauma center in Indianapolis. Doc, welcome to the show.
Hey, man, thanks for having me.
Absolutely. Now, we all, America watched on Monday night as Damar Hamlin collapsed after a tackle. There was 9 minutes of CPR. You know, we're just layman's people here. Explain to us what that whole thing, the scene that we watched on Monday night.
Well, so on Monday night, you know, we got to look at this as we all don't know exactly what happened, but we know some things, right? There's really two ways that somebody's going to end up in cardiac arrest. It's always going to be either the brain and the spinal cord, or it's going to be the heart. I mean, those, at the end of the day, any process that goes on, from cancer to trauma, is going to eventually affect one of those two organs and cause the heart to stop. So something happened that caused his heart to stop. And so we have to say, okay, well, what happened? Well, we can pretty well take out the brain and the spinal cord, because if you're watching the game, he actually got up. It takes a couple of steps. Then he starts to stagger and trips over a Bengals player and hits the ground. And the Bengals player, you know, realizes really quick. So he had to have some look on his face that something was really wrong. So he starts pointing immediately and getting help out there. So it's unlikely that it was the brain or the spinal cord, because those types of things would turn out your lights right quick. You wouldn't actually get up and take a couple of steps. So it was very likely his heart. Now, when it first happened, we were all talking about, every medical professional started to talk about something called a chlamydia cordis, which is a problem that I think a lot of parents know about, because almost all kids nowadays who play pitcher in Little League wear chest protectors. And the reason is that there is a brief period of time, very brief period of time in the cardiac cycle. We're talking about a millisecond long, that if you pop the chest hard, you can actually cause the heart to stop. Because our heart is like an electrical ball, right? And it shoots electricity through. And then it has kind of a reset where all of the ions move to where they got to kind of reset within the cells to get ready for the next beat. And if you pop the chest really hard at just the wrong time, you can almost force the heart to give up a second beat when it's in the middle of resetting. And it can't reset from that second beat. Now, thankfully, that period of time is about 1 millisecond, or 1/1000th of a second of the cardiac cycle. And you have to get hit in just the right spot, in just the right time for this to cause cardiac arrest. But it does so about 20 times a year. That is reported to a national registry. And we estimate probably another 20 that were never reported. So it does happen. It's not super common. And I would have bet you, and most of my colleagues would have bet you, a good bottle of scotch that that's what happened on Monday night. But it's starting to look like that might not have been the case. And the reason I say that is this. When that happens and you get someone resuscitated, they usually bounce back fairly quickly. Because once the heart restarts, there's not a whole lot of structural damage that's done. It's more of an electrical problem, right? If you think about the heart's got vessels and it's got electrical circuits. So you got plumbing and electricity. And plumbing problems cause longer term issues. Electrical problems, if you survive them, they tend to be pretty easy. So he goes down, and if it was this hit, we would have expected to have him back up and out, in a day or two, and not have to be a long time with a breathing tube in. But what's come out is that they just, thank God, removed the breathing tube today. Mm-hmm. And there's a lot of talk about the fact that his lungs had to heal. And that really points to something longer in origin. It's something more structural, right? Because if this wasn't something that just stopped his heart, it caused fluid to back up in his lungs, which means that the heart was likely beating ineffectively for some period of time. And there is a disease out there that strikes lots of athletes a year that's called obstructive cardiomyopathy. It is where the part of the heart that's normally responsible for beating and pushing all the blood out of the aorta, right? The left ventricle. When the left ventricle grows in such a way as to block the outflow of blood from the heart to the aorta, you can get a condition called HOCM, HOCM. And HOCM is a weird thing because the faster the heart beats and the more the heart beats, the worse it gets because it can't actually push blood out of the aorta. And when you read about athletes collapsing, and we've read about it for years, a fair number of them have undiagnosed HOCM. And we find it sometimes unfortunately on autopsy, other times with echocardiograms. And if that had been happening throughout the plays and throughout the game, that would have left him with fluid backup in the lungs after he was hit. And so that's the more likely now, based on the information we have. The third possibility is that there was just something that we'll never know. We call it idiopathic, right? It means we're idiots and pathetic and can't figure it out.
Yeah, but that doesn't happen. That doesn't happen very often, right? 24-year-olds don't just drop of heart attacks. Unknown, right?
No. Now, heart attack's something different, right? A heart attack's when you actually block a blood vessel.
Right. Okay.
I was just explaining that to Bob before. I go, no, listen. I go, we got to explain the difference between cardiac arrest and heart attacks. We're going to ask them so people don't understand because people think they're just symbiotic and they're just not. They're just two different things.
Right, because like I said, there's two systems in the heart. There's the plumbing that gets all the blood to flow around the heart to supply the muscle that is the heart. And when you have a blockage in those vessels, that's a heart attack.
Right.
And you're right, 24-year-olds don't get them because it would require it's kind of like wearing out a tire, right? A tire can blow, but you're not going to wear out a tire in 10,000 miles.
Yep.
Other things can happen, but you're not going to wear it down, right? It's the same thing with heart attacks. When you talk about diseases of the vessels, man, that takes time.
Yep.
And you're not going to see it in 24 years. But what you can have is there's a variety of things. We colloquially call them channelopathies. But basically, there are problems with the electrical flow of the heart because that's a totally different system, the electricity. And so you can have these things. One of them is called Brugada syndrome. There's other like prolonged QTC syndrome, but they're where the heart's wired wrong, and it just causes an arrest. We lost a dear family friend at the age of 4, and the only way they were able to figure out that this is what it was they tested everybody else in the family and showed that there was a genetic pattern, and that's what led us to the diagnosis. In his case, a prolonged QT. But sometimes there are electrical problems that we won't figure out because if nobody else in the family, or if there is nobody else to test, and we don't know the genetic markers for all of them, there can be a selection of this. But again, those tend to be like chlamydia cordis. They tend to be fast if you survive them. If you get the heart restarted, they tend not to cause a whole lot of problem with the lungs. And so I think if you had to pin me down right now based on everything we know, it was probably HOCM. It was probably hypertrophic obstructive cardiomyopathy.
Is that something
that
affect them in the future, or is it treatable?
Yeah, what kind of recovery are you looking at?
Yeah, so that's the issue, right? If you've got HOCM to the degree that it caused cardiac arrest, his career is probably done.
Okay. Wow.
How about
because there's not a really good way. Unfortunately, what happens is it's the septum of the heart that overgrows, and the problem is if you shave it down, it just regrows thicker again.
Yep.
So it's something he's going to have to work on, deal with basically the rest of his life.
Say, outside of athletics, can he live an everyday life, providing that he fully recovers at this point and, everything else pans out?
Oh, yeah. No. Lots of people do. And typically speaking, they'll put in pacemakers to slow, because really what happens with hokum is the faster the heart gets, the less effective it gets. So the more it's beating, the worse it is. And so they'll actually put what are called overdrive pacemakers in place so that they can keep that heart rate slow. They'll put you on medications to put the heart rate slow. But at the end of the day, treatments can help, but the condition can't be cured.
Okay.
And so if that's what it is, and I want to be very clear, I haven't examined him.
Correct.
I'm working on the same reports you're working on. And so I don't have any magic here. If it is hokum, then yeah, that's bad. If it is some weird channelopathy and he just didn't, his lungs reacted bad to it, and those folks, the guys who came back from hits and have been playing professional soccer for years after having events like this. And so, until we know more from his doctors, we can't. And I don't really want to get too deep into, well, if it's this, he's going to be screwed for life. If it's that, he'll be just fine, because we really don't know. I think the one thing I would want everybody to take away is CPR saved this guy's life.
That was my next question. Tell us about how good was the response team, and how they deserve all the credit. I mean,
they coordinated is just amazing.
Absolutely, and realistically, guys, CPR nowadays, we don't do rescue breaths anymore. You don't have to. Now he had an advantage, right? There's a doctor, believe it or not, on the sidelines of every NFL game. It's actually employed by the NFL Players Association, whose sole job, they're called the airway doc. They're a board certified emergency physician. Their sole job is to get a breathing tube into somebody if there's cardiac arrest, because the most likely cause of cardiac arrest in general would be a big, bad spinal injury. At least that's the one that we have to be afraid of in a football game. And so there's literally somebody who's paid on the sidelines whose sole job it is to get a breathing tube in. And while that was great, and I'm sure that it was done incredibly fast and certainly was done very skillfully, the key was getting CPR started. Yep. Right? The key was recognizing that he was in cardiac arrest and starting to push. Now, the other thing to keep in mind is CPR is not complicated. You just got to push hard and push fast. So if you come across somebody who is down and they're not waking up, truthfully, you don't even really have to feel for a pulse all that much.
No.
I mean, absent a football game, right? Start doing chest compressions. If they wake up and knock your hands away, great.
Yeah.
But realistically, you start doing compressions, and you do them to a depth of about 2 inches at a rate of 100 beats per minute, which happens to be the song "Staying Alive."
And Baby Shark, and Baby Shark.
And Baby Shark, and another one bites the dust if you're talking about your ex-wife collapsing in front of you. But, any which way it goes, man.
Why do you,
but you have to do it.
Why do you think they did it? Why do you think they left him on the field for 9 minutes? Because for me, that seems like a long time to be doing CPR.
Waiting to restore that pulse. They were trying.
They're waiting. Yeah, absolutely. You work them where you find them.
Yep.
The reality is, it is damn near impossible to do good CPR on the move. And so nowadays, we know that what you do is you work them where they are, and you don't move until you get a pulse back. And there's a lot of times and a lot of situations, and people don't get it, but nowadays, if you call an ambulance even, and your loved one's in cardiac arrest,
they don't leave.
They're going to stay right there.
They don't leave, and the people are yelling at them to leave, and it's a very difficult situation. But you look at the amount of coordination that these guys came in, the training that they had to all come together. It's kind of an amazing thing to see the response time that he had, and the recovery he had is really based on get in there and don't wait, and make sure time is so important in those situations.
Oh, absolutely. I mean, at the end of the day, with what we know for sure, and what they've said several times, is he's completely neurologically intact. And that's a testament to the resuscitation, right? Regardless of whether he plays again, he is the person he was.
Yep.
He remembers first grade, right? He's got the big heart that he's always had. He's going to have the personality that he always had. He didn't lose brain. And the reality is if you don't start that resuscitation and keep that resuscitation going, people will lose brain.
Wow.
And that's bad, right? Because a lot of times when we get somebody back medically, right, we'll get somebody back and we can get their heart restarted. We got tons of drugs, man.
Mm-hmm.
We got drugs, we got electrical machines, we got zappers, we got all kinds of stuff. We can get your heart beating again. I mean, heck, I can get my grandmother's heart beating again. She died in 92, right? But the problem is the brain's gone.
Yep.
And where the CPR really helps, where this fast response really helps, is number one, it gets the heart started again much easier, right? For every minute that CPR is delayed, the chance of resuscitation falls 50%. I mean, think about that for a second. That's like every minute you're losing 50%. So you have to start early, but even if we manage to get it restarted, part of the reason you have to have a successful resuscitation, you have to start early, is that brain's got to keep oxygen flow.
Yep.
Because if it doesn't, you'll get the body back, sort of, but you'll have somebody that the person that they were will have died on the field, right?
The organs may recover, but the amount of oxygen loss in the brain just isn't going to get the function back.
And no, it wasn't like a really big hit. It wasn't a big tackle that I saw. And like you had mentioned, the heart guards, and the way I looked at it is, I know shoulder pads almost come down to cover, the sternum and the heart area. Would you suggest that the NFL maybe improve on have these guys wear heart guards? I mean, they barely wear leg pads at this point. They're almost out there wearing nothing.
I think we need to figure out whether or not this was comedic cordis, right? I mean, theoretically, that's going to be the first step before we start talking about protection. But the other thing is that we do know about the condition, and the reason that baseball players wear it and hockey players wear it is when we look at the registry, the overwhelming majority of these, not all of them, but the overwhelming majority of them, come from projectiles, either hockey pucks, baseballs, lacrosse, what do they call a lacrosse ball? Whatever they call a lacrosse ball.
Yeah, it's hard.
Hard. That punches have been known to do it. And so it tends to be a sharp projectile type of blow. Now, that said, the way that he got hit and the angle that he got hit, they might have actually been able to do kind of almost a CPR compression from the blow. If it was comedic cordis, then it was like then likely what happened was his entire thorax kind of got squeezed. Right, his forward momentum made his heart move forward in his chest and bounce off of his sternum, and that caused it. And the problem with that is, you're talking about deceleration and you're talking about a hit. And I don't know how you can remove a hit from football, right? I mean, the bottom line is he was moving in one direction, the other side's moving in the other direction. The body's physically stopped, but the organs inside the body didn't.
It's almost similar to a concussion in an odd way, just bouncing off and that freak thing where, another thing the NFL could honestly improve their equipment on immediately if they wanted to.
Absolutely. I mean, I think that's exactly it. The concussion analogy is perfect because it is. It's not, in the concussion, the brain's sloshing around. In this, if it was this comedic cordis, then it's really the heart sloshing around. I don't know that there's a lot of data. And one of the things that is hard too is, like I said, this is something that happens that we recognize and put in a registry about 20 times a year. So there's not a whole lot of data, right? We do know that projectiles cause it more. We do know that, people are like, well, it seems to happen in the young. Well, no, because the young are the ones who are playing baseball and football and hockey and lacrosse, right? We don't have senior citizens generally.
Isn't that part of the thing where typically a lot of this stuff is figured out more at a young age once they start playing those more impact sports and even not that, but other almost more underlying heart conditions with kids and stuff like that, whereas they don't even get to the NFL level because they would have figured it out by this point.
Right. And that's one of the problems with hokum, because if it is this hypertrophic obstructive cardiomyopathy that I was talking about, it's an insidious thing, because as you grow and age, it gets worse and worse. So, if he has an echocardiogram at age 12 because somebody got a grant to do it for a bunch of Pop Warner kids, he might have only been at the high limit of normal at age 12.
Yep.
And now at age 24, having that supposed clean bill of health the decade before, it's grown.
No.
Right? I don't know about you, but my hand is bigger today than it was when I was 12. I'm going to assume my heart is too.
Yeah, the more you work it.
Now, this is an odd thing with the NFL as far as the heart goes. It's mostly been head injuries has been the big issue, and the CTE and everything that goes along with that. The NFL has been, listen, in the past, they've been terrible with this. They came out and they killed that doctor in that documentary, and they lied and they lied and they lied, and Goodell just lied about everything. They were almost like the tobacco industries. Do you think they do enough for the head
This one
injuries?
happened right in front of everybody's face, though, on national TV.
Yeah, but the head injuries, you know what? These people...
They do, but it's more of a later effect than a lot of those.
You look at a 50-something-year-old NFL player, he almost looks 70. What do you think?
If you're gonna ask me, do I think in general they do enough for head injuries? No.
Yeah.
All right. I mean, listen, I got to be honest with you. I love the game, and I got two boys, and they won't play.
Yeah. They don't play. That was going to be one of the questions as well.
I'm telling you, I played a lot of Pee Wee football, and I didn't really play much any high school football. I don't recommend it especially for young kids. I don't think I would let my kids play either.
I won't. My boy really wants to play, and I won't. The problem is concussions, and the problem is, the insidious nature of them, right? You keep getting them again and again, and you lose brain. I mean, there's no question about it. Now, as far as what they could do to make it better, there's a lot of information coming out of Duke. There's a lot of studies that are going on, and I would hope that they're gonna move to make things better. That said, when it comes to the heart, at the end of the day, this is an incredibly tragic event, or almost tragic, right? Because you guys don't recover. Mm-hmm. But it is unbelievably rare, and so I don't know that we can yet say, "Oh, it's the NFL's fault. They need to do X, Y, or Z to improve this," because number one, we don't know what it is yet. Yes. To do a test for hokum, if it turns out to be hokum, that's actually easy. That's an echocardiogram. They could certainly afford it. It takes a couple of minutes, and there's no risk to a patient, right? It's an ultrasound of the heart. We could screen everybody in the league for hokum, but the question is, are you going to find? How many of them are you going to find, and what are you going to do with the ones that you do find, and you destroy their career when most of the folks who've gotten to this age and to this level of play, this thing has made itself apparent. And really, how many times has this happened, right? We know that there's been one other on-field death, and it wasn't hokum.
Yes.
So if that's what this was, then you got one case of it. If it was Camino Cortis, you got one case of it. And so and that was kind of my point when I said, we've only got this registry of 20 per year. It's hard to get any kind of a recommendation, right? The problem with concussions and CTE is there was a ton of data, and there still is. And the doctors who were initially, sounding the alarm were silenced. But they were able to use, hundreds and thousands of cases of, these brain damaged, punch drunk guys, right? Because it's not just the NFL that they had data from. They had data from boxers. They had data from hockey players. There's plenty of brain injured folks out there. There's not a whole lot of folks who drop at this age that we can get the same kind of studies together to robustly say this is how you prevent it. Because, if you're talking 20 times a year and you say, okay, well, the NFL, we changed something, right? We changed the pads, and we don't have another case like this for right. 10 years. Is it because we changed the pads, or is it because we weren't going to have another case of this for 10 years?
Yeah, and the NFL's a business. They're greedy. They're just like any other business. Businesses need to be forced into stuff.
But if nothing else, let's hope this brings to light, just the overall, let's look at any safety improvements. Yeah, you're right. If you focus all the money and all the energy specifically on this one thing, honestly, it may not even prevent another one. And if you can go out and just overall protections is really the NFL to be brought to light in the public with everything. They really need it.
Well, there's two things I would say that. Number one, what it really should do is get everybody to take CPR. Bevan, I'll send you guys a link to a video that I did a number of years ago. The video alone will teach you how to do CPR, and will teach you why to do CPR. Right? You guys can put that out with your show notes. But
Absolutely.
Number one, the NFL should be getting behind everybody learning CPR. Mm-hmm. There's no reason not to do it, right? The only reason to not do CPR is you got no arms and no legs.
Yep.
Yeah.
Everybody else should be able to do it.
Too easy, too simple. Your loved one falls in front of you, and you can do something about it. And a lot of people don't.
And the other thing that the NFL can do if they want to do something about this, and we gotta give a shout out to the New Orleans Saints, right? Because they led the way in this, but they turn around and they have bought AEDs, right?
Yep.
That's the other part of this. If the electricity is a hard bad, AEDs are tremendously helpful, and he was defibrillated on the field. And he was defibrillated by a doctor saying, I detect a rhythm that needs to be defibrillated, but we've got machines we got AI that'll do that for you. And they're relatively cheap. And so
we have a mandated in New York where we are. We have a mandated public schools, fields, all government buildings.
We got them in the jails.
And let me tell you, we've had many kids and many people in general, because a lot of times it's just people in the stands. You know how many people are alive just from that?
Yep, absolutely. Actually, what's funny is they put them in the airports in Chicago, and it's a great story, but the first person saved was a priest saved by an off-duty fireman.
That's amazing. Wow. I've used it many times. I've used it in the jail more times than I can count. Done CPR more times than I can count. And let me tell you, quick response time, people around you that know what they're doing, and just honestly, just doing the simple things is what works.
So we got to give that shout out to the New Orleans Saints, because they went around to all of the athletic facilities around them that didn't have them, and apparently they have bought like hundreds of AEDs for places where they weren't. And so if the NFL really wants to get behind and do something about this, I think what they have to do is look at the youth who are up and coming, and look at their fans and say, look, we got to teach CPR. We got to equip everybody with AEDs. We got to get it so that response, that wonderful response that saved Hamlin, we got to get that to everybody, because we have that technology. We have that knowledge. This has been a public health push for years.
You're going to be able to have that in your pocket soon.
Yeah.
There's no reason why not.
Well, and there's absolutely no reason not to do CPR, because the reality is, even if you don't have the AD super close, right? If you're doing CPR, you can keep the heart in fibrillation for a good couple of minutes while they get you that AED. But AEDs need to be out much more in the public than they are, and you need to be able to access them, and people got to know how to use them, and they're really easy. Like the most basic ones will actually tell you every single thing.
Barry, you open that thing up, I'm telling you, it's very simple. They lay it right out in front of you.
Now, where can people go to get CPR trained? Can they go to the hospital? Where can they go?
You can go to hospitals. You can the American Heart Association teaches, the American Red Cross teaches. Most fire departments offer classes.
Ambulance companies, yes.
Ambulance companies offer classes. And like I said, I will send you guys a video that I did back in 2012 when we first introduced the idea of hands-only CPR, where I was the medical director, and it goes through it, right? 10 minutes, you're going to be able to learn.
Please do. We will post that on our social media. That's important. And that's the biggest stuff. You can learn all this stuff and other stuff. YouTube, all this stuff. So, let me tell you, you want to learn, you can learn it right away.
The NFL's got a problem, because a lot of doctors are just like you, doctor. They're saying they don't want their kids playing. And the NFL is going to have a problem eventually with that.
No, absolutely. But in this case, I got to be honest. In this case, I'm not thrilled with the way that they were trying to leap right to playing again. Their response is what saved this guy's life, right? I mean, we can't, and I think I sent you guys that picture, but
yes,
we cannot overstate the fact that the guys who are making the least money in the stadium, the guys who were on the ambulance, the couple of paramedics that were part of that resuscitation team, were among the most key players out there. I mean, this was the trainers, this was the team doctors, and this was the EMS personnel that allow us to be talking about how we should all be praising God because this guy's waking up and he is himself, versus if we weren't, right? If they weren't there, if they didn't do their job there as well as they did it, they would, we'd be talking about, how nice of a funeral this was.
Wow. I mean, listen, they did a great job, and it was great.
Kudos
They
to them,
did
for
the
real.
job. They have an hour-long meeting an hour before the game. They have a big meeting with exactly what to do with this, and you heard they released
hours
the
and
audio.
hours and hours and
training.
years of training to make it where just to prepare for this, and the people can look at them and waiting for stuff like this to happen, and the moment is they were ready.
Yep.
Exactly.
I mean, that's what training is. I mean, even down to the fact, if you're ever watching a game and you see a guy who's in a polo shirt and a red hat on the sideline, that's not a political statement. That's the airway doc.
Oh,
They
wow.
got
Very
red
good.
hat
I
because
didn't know. Yeah.
everybody knows the guy with the red hat.
So important.
That's the airway doc. Get out of his way. He's going for the airway.
Wow. Well, listen. We really appreciate you coming on here, Doc. This
Really
is
great spot. I
Important
appreciate it.
information. Send us that video. We want to put it up, and we're going to point everybody in the direction to go get their CPR training. Make sure you get it done. His name is Dr. Howie Mell. Doc,
Thank
really
you, Doc.
appreciate it.
Hey, anytime, guys.
Absolutely. Thank you, Doc.